Let me just firstly say I, like my colleagues, commend the government for responding to not just the concerns of a few vocal advocates, but really the concerns across the Australian community that we have left many people with mental illness and their families sitting on the sidelines while many of us enjoyed over the last decade or more the fruits of our nation's prosperity. I think tonight's investments and initiatives that have been announced by the government really do respond to those concerns that have been very loudly voiced on all sides of politics. We saw the federal opposition propose a motion on mental health last year that was supported widely across the political spectrum, and tonight, at the very first opportunity, the Gillard government has delivered in response to that parliamentary and broad Australian community concern about the state of our mental health services. It's not just the size of the investment, that's a very welcome investment, and as Ian Hickey has said, it does, I think, provide opportunity to leverage off the states as well. The government's been quite, I think, smart in ensuring that there are competitive grants processes in the form of the national partnership agreements to leverage up the investment in areas that are widely known gaps in services and engage the states and territories in that process. I think the other aspect to tonight is that we see in these initiatives a number of reforms which I believe will drive structural change in mental health services and bring our services into something like what the evidence would support in terms of a 21st century mental health service for Australians and our needs. We've heard tonight from the National Farmers Federation about the state of mental health services in rural and regional and remote Australia. Well, right across Australia, we know that services are struggling to meet the needs of their communities, and I think this investment tonight will go a long way towards addressing those needs. But I particularly pay I guess an acknowledgement to the government that they've not just focused on mental health services, they have focused on employment services, and there are a number of initiatives in the employment programs which will make it, I think, easier. It's certainly a challenge for people with mental health problems to gain and retain employment, and there are a number of initiatives there tonight which I think will achieve that end. There are also initiatives in the schools area to support children with developmental and learning difficulties which later manifest as mental health problems in later adolescence and adulthood. All of these are welcome initiatives.